Hi, I'm Nurse Megan. Part of my job is to educate people about diseases and how to reduce their risk factors. One of the most devastating diseases of this century is cancer. There are many cancer subtypes, but today we are going to learn about cholangiocarcinoma, or CCA, which accounts for 3% of cancers of the digestive tract worldwide. So, what is it? First, let's break down the word. Cholangio means the bile ducts, and carcinoma means a type of cancer that forms in the epithelial tissue in our bodies. So, cholangiocarcinoma is bile duct cancer. Your bile ducts are a network of small tubes, or ducts, that connect the liver, gallbladder, and first part of the small intestine, the duodenum. The network starts in the liver where bile, a fluid made by the liver to break down fats during digestion of food, is collected in small ducts that join up to form the right and left hepatic ducts, that then join up outside the liver to form the common hepatic duct. From here, the common hepatic duct is connected to the cystic duct which connects to the gallbladder. Bile passes from the liver through all these ducts into the gallbladder, where it is then stored until it is released down through the common bile duct, passing through the pancreas and ampulla of Vater into the small intestine to help break down our food. Carcinomas are the most common type of cancers, and like all cancer, begin when a genetic mutation transforms a normal, healthy cell into a cancer cell. That cancer cell keeps multiplying and making more cancer cells, resulting in a tumor. Carcinomas form in the epithelial tissues that line all internal and external surfaces of bodies, like your organs, glands, and skin. Cholangiocarcinoma, or CCA in figure A, is divided into 3 subtypes, based on anatomic location. ICA, or intrahepatic cholangiocarcinoma, or in the bile ducts inside the liver. PCCA, or parahilar cholangiocarcinoma, found in the area where the common hepatic duct is, or DCCA, or distal cholangiocarcinoma, found in the area where the common bile duct is. In figure B, you can see the various cells of origin in CCA. Cholangiocarcinoma happens when epithelial cells of origin in the bile ducts develop changes in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The changes tell the cells to multiply out of control and form a tumor that will invade and destroy healthy body tissues. Behind me, we see the 3 different patterns of growth in cholangiocarcinoma. On the far left we have mass forming, then in the middle, periductal infiltrating, and on the right, intraductal growth. Signs and symptoms of cholangiocarcinoma include yellowing of your skin and sclera, which are the whites of your eyes, intensely itchy skin, white-colored stools, fatigue, abdominal pain on the right side, just below the ribs, losing weight without trying, fever, night sweats, or dark urine. CCA are aggressive tumors often diagnosed at an advanced stage, making successful treatment difficult to achieve. The exact cause of CCA is unknown, however 20% of patients have a known risk factor for developing CCA. Due to this knowledge gap, I think it is important that I teach you the risk factors and how you can prevent CCA. Here we see the risk factors. Starting at 12 o'clock, we have genetics, obesity, which we can prevent by maintaining a healthy weight. Alcohol, drink alcohol in moderation if you choose to drink. For healthy adults, that means up to 1 drink a day for women, and up to 2 drinks a day for men. Diabetes, congenital anomaly, cirrhosis, hepatolithiasis, inflammatory bowel disease, IBD, primary sclerosing cholangitis, PSC, which causes hardening and scarring of the bile ducts. Liver fluke infection caused by a liver parasite found in areas of Southeast Asia, which can be prevented by avoiding eating raw or undercooked fish. Virus, and other notable risk factors are older age. CCA occurs most often in adults over age 50, though it can occur at any age. And lastly, smoking is linked to an increased risk of cholangiocarcinoma. If you smoke, stop to help prevent CCA. Approximately 6% to 20% of all CCA diagnoses are explained by PSC. In the absence of it, an American study found that early adulthood onset of obesity was a significant risk factor linked to CCA and might predict early diagnosis at a younger age than a normal weight individual. So, until our next lesson, aim to reduce your risk factors for CCA and share what you learned with friends and family.